Slats gets a tongue lashing to find the best solution to bad breath.
Oh, this is gross, Jeff. Gross.
Hey, what's good for you? Did your mama tell you what's good for you?
Did your mama tell you what's good for you?
What's good for you?
Thank you. I'm a huge fan of Italian cooking, but sadly, there's a price to pay for all those garlic-infused morsels. Excuse me. Can I just ask you, do I have bad breath? No, come back. It can't be that bad, surely. I was just trying to explain that bad breath is something that many of us have experienced, but whether it's a temporary or chronic problem, ridding ourselves of this embarrassing condition can be no mean feat. So tonight, we're going hard on halitosis by finding the best cure.
Turned down by the Army. Turned down by business. Turned down by the girls.
Yep, it's no fun being halitosis Hal. Trouble is, you often can't smell your own breath. And if it's bad, it's not the kind of thing even a loved one will tell you.
Alan, your breath's not good. He said, what do you mean? It stinks. And I said...
Rhonda Cox has an issue with husband Alan's breath.
I'm smoking a lot of cigarettes a day and probably drinking minimum 10, maximum 15 more cups of coffee a day, and that was impacting on my breath.
Coffee contains an acid which causes bad breath bacteria to reproduce in your mouth. Adding milk just makes it worse.
Have a good day.
Okay.
I'll see you.
Now, he might be orally challenged, but Rhonda and Alan Cox are still very much in love. We want it to stay that way, so we've organised a little experiment. My mate Alan has agreed to help us, but to make sure his breath is really on the nose, he's been eating a high-protein diet and he hasn't brushed his teeth for 2 days.
Morning, Sluts. How are you?
Morning, Al. Great to see you. Can you just stand over there? Thank
Yes.
you. Now, I have to admit, I'm in on this as well. I spent all day yesterday eating garlic, I haven't brushed my teeth, and I had a strong coffee for breakfast. Now, Al, if my breath smells as disgusting as yours, then I think we need some treatment.
I think we do.
OK, let's go through. Just keep your distance, though.
OK.
Up this way. We're at the Australian Bad Breath Clinic, the brainchild of dentist Dr. Jeffrey Spicer. He's got this great little machine called the halometer, which allows him to measure degrees of bad breath.
If the person reads over 200, then you can already start to smell their breath in normal conversation levels. If they read over 500, then you can smell them from a few feet away. And if they're unfortunate enough to read over 1,000, they can leave the room. You can come back in 5 minutes later and you can still smell them. Open your mouth, straw right in to the back of the mouth and just breathe normally.
A normal reading is between 80 and 150. So let's see how Alan goes.
Going up. You do have a problem, Alan.
Still going up, Al.
255, 260, 270.
So Alan scores 280 on his breath test.
Slats, it's getting up there. You're over 150. No, this is serious stuff. You're over 150. Listen, you're getting to 200. You're over 200. That means you actually do stink.
It's very embarrassing.
Don't worry, we'll fix you up.
The halometer booked me at 247. Not quite as bad as Alan, but it can't be denied we're both well over the bad breath limit. Yep, we need that cure. But first, what are the causes of our oral odour? Sometimes it's illness or even the medicine you take. But overwhelmingly, the problem lies in your mouth.
95% of bad breath is solely due to having the bacteria in your mouth and not getting them out of your mouth.
Word of warning, if you're eating, stop. This is where it all gets a bit ugly. Bacteria breaks down your food. With some kinds of food, especially proteins and dairy, this process results in sulfur compounds. The most common is called cysteine. This mixes with air as you exhale to give you bad breath.
This is an egg that's been left out for a few days.
Here we go.
Now, egg has cysteine in it. All right, so basically the milk makes cysteine. So if you have a lot of dairy, that'll be broken down and you'll make this cysteine. But if you have a lot of eggs, you actually are going to be putting cysteine straight into your system.
Now, eggs are a great source of protein, but eat too many and you can expect some side effects.
Good. Good smell.
OK, cure time.
Quite hard.
And the first thing we're instructed to do is give our tongues a lashing with our toothbrushes and then with this special scraper.
All right. You scrape first, Del. You go. Oh, can't look. The noise.
Oh, it looks disgusting.
This is gross, Jeff. Gross.
But what it's doing is scraping off all that nasty bacteria that's been accumulating in my mouth.
Feels a lot cleaner. Well, it's been 2 days without brushing my teeth. Good job, Al.
How's that now? Nice?
Yeah, I can get up close and personal now. That's good.
But I'll be able to get even closer after taking Dr. Spicer's secret weapon. It's breathtaking, literally.
Swizzle around again. Off you go.
This special mouthwash, developed in New Zealand, contains a probiotic. That's a good bacteria which fights off the bad bacteria in your mouth to keep you smelling fresh. The Australian Dental Association says if you've ruled out dental decay and infections as the cause of bad breath, these probiotics are definitely worth a look. Your saliva will go from this to this.
On this side, we put the good bacteria, and as you can see, we have less bacteria on the good bacteria side to the other side.
So is this showing what would be happening in the mouth?
Yeah,
the bacteria
that's right.
that can grow
That's
in the
right.
mouth, and then with a good probiotic...
That's right. So if you have a
reduce.
good probiotic, you're going to keep those bacterial levels down.
So what's the halometer got to say about all this? Well, Alan now registers 149, which is down from 270. He just scrapes into the normal range. And mine's knocked right back from 247 to 80.
I think you pass.
Ah, the sweet smell of success.
Okay, good.
The probiotic worked a treat, but at $280 a year, it's not cheap. And you'll need to keep going with it to maintain your good breath. But here's some more top tips from Dr. Spicer for battling bacteria in the mouth. Don't use an alcoholic mouthwash. Chew gum that contains xylitol, a sugar substitute. Avoid alcohol and coffee in the day. The more you brush, the more you'll benefit. And don't forget to floss. No more embarrassing problems for Alan or myself. Our mouths are as fresh as a daisy. So if you're someone prone to bad breath, dental hygiene is a must. Also, avoid a high protein and acid diet and stay away from strong smelling foods like onion and garlic. Still worried? Well, best see your dentist and a doctor. They'll get to the bottom of your problem and rule out any serious health issues.
What's good for you?